and welcome to Fyrside Chats, conversations that inspire innovation. Fyrside Chats is a series of conversations with startup founders and enablers, leaders in business and government, and industry players in Western Visayas that push for innovative ideas that impact communities. This series is an initiative of FyrLab, an Iloilo city-based startup acceleration program funded by the Department of Science and Technology Region 6 and run by Youth First Initiative Philippines Inc. with support from Western Visayas, a regional consortium for startup enablers and the Iloilo Innovate Iloilo movement. I am Anvi Magbanwa, your host for today's chat, and we are currently here at Kutsu Cafe located at San Rafael, Mandurriao, Iloilo City. So good morning everyone, and with me here are two respectable professionals in the field of mental health. With me here on my left is a beautiful lady and a handsome gentleman, Dr. Mitz, and with me also is Dr. Bang Bang. Dr. Bang Bang, as everyone fondly calls. Let's start first with Doc. Doc, can you introduce yourself a little and give us a short background on how you reached this kind of initiative or this kind of cause or field?
Hello everyone, good morning. I'm Dr. Maria Annabellee Salanatin. Of course, as you have mentioned, I am more well known as Doc Bang. And I am a medical specialist of Western Visayas Medical Center. And I had my training also at the same hospital. And I am way back 1996 to 2000. That's a long time ago. And I'm here now as a medical specialist.
Thank you, Doc. How about you, Doc Mitz?
I'm Dr. Mitz Serofia. I'm currently a Psychiatry Resident at Western Visayas Medical Medical Center. And Doc Bang is one of our contacts. I'm also the co-founder of Welby. So it's a startup dedicated to workplace well-being, which I think we'll talk about more later.
Thank you very much, Doc Mitz and Dr. Salanatin, for being with us here today to talk about mental health in the workplace. So, we hear this concept all the time of mental health, and it's very much a fundamental part of who we are as humans. And by mental health remains an obscure idea for many. And what does mental health really mean, and why is taking care of it very important?
So we can use the WHO definition of mental health, which is really easier to understand. So according to WHO, mental health is our capacity to live a full and productive life, as well as our capabilities to cope with its ups and downs. So it's not merely an absence of mental illness, but it is our ability to cope with the different stress that is coming into our life.
So ayan, there's a very clear definition that mental health is not just the absence of mental illness, but it's actually to cope with the changes that we deal with every day. So with that, given the definition of mental health, how is it important in the workplace? I'll give the question to Doc Mitz.
So generally speaking, there is no health without mental health. So a person who's really fit, a person who is really successful, but at the end of the day, if his or her mental health suffers, at the end of the day, he's a lost cause. So it's important that we get the balance of both the physical and mental health. And in the workplace, that translates to a lot of things. For one, it affects the morale of the employee or the employer. And this kind of behavior, the pattern of thinking and ways of doing things of the employer and the employees affect business outcomes. So we can see like in workplaces where there is toxic work culture, we see higher turnover, lower retention, poor productivity, and lesser sales.
And maybe I could add to that, if we are not going to take care of our mental health, it will lead to a lot of problems. So this may lead to absenteeism, no? Number one, frustration in work, mental health problems like depression, anxiety, and eventually even suicide. And it could also lead to violence in workplace, and it could adversely affect our way of life and our relationship with other people as well as with our family.
So with that, there's very much a very big and very strong bond between mental health, productivity, and relationship building in the workplace. And currently, what are, or generally, what cases have you handled, and or what are common motivators that pushes people, or reasons for people why they are seeking for mental health assistance or intervention?
Well, most common nowadays, especially during pandemic, is fear. Fear of contracting illness, fear of probably having a mental illness, fear of COVID. No,
Yes.
that's the most common motivation. Poor sleep because of problems with pandemic and economic crisis and a lot. No, that's the most common. But in the emergency room, most people are brought in the emergency room because of violent behavior, restlessness, suicide. What else? Poor compliance to medication. So that's among others.
So there's really a high, or there was a rise in the interventions that needed to be given to people during the pandemic, most especially.
Yeah, it's especially during the pandemic.
You have mentioned also, Doc, earlier, it also contributed to the anxiety of everybody. So with that, it leads to, for those who are also doing the shift from workplace, office, physical workplace to shifting to work from home, it also contributes as a stressor, I believe, because there's an adjustment, an abrupt adjustment for that matter, that needs to happen. So how do you, or what can you give, what advice could you give to those who are transitioning, or now that we are already going back, quote unquote, to the new and better normal, as they say? So how would you, or what advice could you give them in terms of transitioning back to the first setup that they had?
That's a very good question. Actually, the DOH is very active when it comes to advocacy, especially during pandemic. We have a lot of seminars, especially mental health support, the psychological, psychosocial support, and we have these sets of things that we can do. We even have a journal wherein you can write your activities, your daily activities. You can write your schedule, what you're going to do for the whole day. So that would be something that could help you with boredom. No? So you have there, for example, you can start with a prayer in the morning, right, Mitch? Then you can plan, you're going to have your exercise. Exercise is very important. It could help us with our feeling of well-being. Then you can put something like, I'm gonna eat at this hour, healthy foods. Hindi yung chowking and fast foods, hindi ganon. Nutritious foods, vegetables, fruits is very important. Something that will rise our serotonin level. And then you can have your meditation. You can also do meditation when you are so angry, when you are tired working. You can do meditation, even if just for 15 minutes. And then you can do relaxation exercises too as well, like dump up, naka sa trabaho, then you have to relax a little. You can do flexing. I think Mitch knows that. She has been, of course, they are taught how to do this alternative way to relieve us of our stress. Then talking to friends, talking to those you love, even video chat lang. What else, Mitch? Did I forget anything? Maybe you can add.
But I'd just like to add that in this transition period, many business leaders actually say that the pandemic is the great reset. And I would like to believe that it is also the case for the workplace. It's about high time that business leaders or employers give more priority to mental health or well-being in the workplace, which they might have forgotten or might not have prioritized before the pandemic. So what they can do, I think the main challenge here is with the employers, because the employees will just follow suit. They'll just be absorbed with whatever system that they go into. And so this has to change. If we want a better normal in the workplace, the system has to change. And the challenge goes out to employers or business leaders to really prioritize mental health in the workplace by, one, making sure that the culture of well-being is valued and is defined in the workplace. Second is, this is through like creating mental health programs and policies wherein they can bolster or they can sustain the well-being of their employees.
So this question goes for Doc Mitz. Speaking of workplace well-being, tell us more about your startup, Welby.
Okay, so our startup is called Welby. So it was founded last year. So we're we're 1 year old now. It's a business-to-business people well-being services and data analytics provider that brings out the best in your workforce. So what we do is we invite business leaders or employers to really have a check-in into their culture of well-being in their organization. And we identify with them the problems that they're having, or if they're not having any problem, in what ways can we boost the well-being of their employees. So we do that through workshops, we do assessments, and we do consultancy. And then in the future, we're looking at building a digital platform where all of these things will be put in place together for convenience and for more accessibility of both the employer and the employees.
We are so proud of you, you know. All of us are proud of him, really.
Thank you, Doc.
Oh.
From the mentor. So with that, Doc Bang, work is really a big stressor in the environment of working, especially young working professionals right now. For those also have high pressure in the workplace, in your experience, what are the common factors in the workplace that could trigger mental health conditions?
You are correct. Job pressure is actually number one a reason for stress in the workplace. But there are a lot more. We have environmental, that would be political uncertainties, economic uncertainties, what else? Yeah, that's it. And then we have personal. No, ang personal naton, we have our family problems, monetary problems, sickness in the family, poor relationship in the family, or marital conflict. And another one is personalities. No, that's it. And the last one is organizational. I think Mitz could relate to that. Organizational, job overload, unclear role in the company, less compensation probably is one reason. Toxic boss. Yeah, well, I hope I'm not toxic. Toxic boss, yeah, like that. And other people, no, your staff that you are in conflict with, difficult workmates, no? Difficult workmates, because all of us have our own different personalities, kisa hindi mag-match, no? And then unclear ba lang work description, yeah, this definition. That's organizational. And of course, sudden fluctuation of, job layoff na, amo na siya. Okay.
Because
And even promotion is stressful.
No, it's stressful because it's another pressure. It's loading and unloading of pressure to you.
As what Superman says, no?
With great power comes great responsibility, especially for right now during the pandemic. I think if there's one good thing that pandemic brought about for the issue in mental health, actually put it in a scale that everybody is made aware that mental health is important, because everybody is experiencing it. And there's no shame in having concerns regarding your mental health, because basically amo to ganihambal ni Doc Mitz, mental health is part of your overall health, and it's very important to take care of not just your body but also
Actually,
your
it's
mind.
3/4 of your overall health.
So basically, it's the driver of your overall health. If it fails, medyo alanganin na siya. And it's also very important that parang holistic ang approach niya, because the treatment or the remedy that we offer for mental health, for those who are experiencing mental health conditions, it is not just one way. Hindi na siya pwede yung doc nga inom ka lang bulong. It should be holistic from your environment, from your workplace, etc. So, amo na siya. This one, another question, I think for Doc Mitz. Doc, when you started Welby 1 year ago, when you were trying to pitch it to people, what were their initial reactions?
It depends on who we talk to. For those who are not really aware about the concept of workplace well-being, it's like meh. It's like they don't care. But for those who really understand what it means and what it does to the business, they're really very open about it. In fact, when we pitch it to friends who are in the same circle as ours, they initially like the idea enough for them to really tell us, okay, you started already. You will be your first customers, and so they did.
So it's very important to actually have a circle that understand your advocacy and what you're trying to do. So for this, despite all this rising in the we call this parang hindi naman siya uprising, but a mental health issue came to light during pandemic. But despite that, there's still stigma about mental health. And what do you think can we do in order for us to be able to normalize it?
Well, I think we are actually doing it. Mental health awareness. Stigma has been there even before Christ. As we all know, even in the Bible, there's already stigma when it comes to mental health. So we are doing a lot of mental health awareness, lectures, TV programs, radio programs, with collaboration with UH, and it has helped a lot actually. Our basis, you can check it out sa patients who are coming in our clinics. Okay, right now we have a lot of patients, non-psychotic patients coming in our clinic with simple psychological problems, issues like hindi katulog lang or na I want to be sure nga they are mentally healthy. Now they just come into the clinic and without feeling the assurance, without feeling stigmatized. No, it's actually working, and probably we can continue what we're doing right now. And
so there has to be again a systematic movement, with regards to correcting or improving the stigma that's attached to mental health. So yeah, it cuts across different areas in society. So we start first with the education sector. So students or pupils have to learn about what mental health is and its importance. It must also be present in the workplaces. So regular mental health education in the workplace should take place. Third, in the media, like what Doc Bang said, and also promote the Mental Health Act, as Doc Bang has mentioned. So the Mental Health Act has been made into a law last 2018, if I'm not mistaken. June. It was June 2018. And so we already have that policy in place. It's a matter of implementing it. So this is again a call to all agencies and organizations involved to really make sure to put a teeth into the law, so that we get the gains of such a very, very nice law that we have.
There is something in that law about discrimination against mentally ill persons.
Yes.
So that would really help.
I think we are doing a very good job in terms of putting it out there, because the first ang hambalgan nila, the first way to break the stigma is to just put it out there, to say it out loud. And we are very much grateful for you guys on being so brave and in advocating this, despite all the stigmas, despite all the bashing, and those that haven't understood what mental health is. We are very much proud, and we are very thankful that you guys exist for us to be able to push through with this noble cause, because it's actually parang kumbaga literally brain siya. You're literally dealing with the brain, and if the brain fails, everything else fails. And with this, I would just like to ask a few words on why should companies in particular be able to, or should be able to invest in mental health, and what are the ways that they can, or measures that they can put in place in order to ensure mental health of their employees?
I have, my children are working in companies now. And I'm really happy to know that they have their team building. It's every now and then. And hambal ko kasi yado kasako how the permi kagalakat. My R&R, it's really helping. So every company should have that. They should have the what we call in our field, our mental health day. No, we have that mental health day. So if they could have that every 3 months or twice a year, it's okay. And I'm really happy where my daughter is working, because they have it as often as quarterly, I think. And it's really good. And they should have, all of the manager, the supervisors, etc. should listen. Should listen to their employees. No, hindi nga akigan lang di, akigan dito, sugo dito. They should also listen. Okay. Mitch.
For my part naman, I think companies should go beyond that concept that mental health webinars are there during Mental Health Month, or we'll have like awareness campaign on that when one of our employees commits suicide. They should not treat this very important thing in a reactive manner, rather than be more proactive about it. So they should make mental well-being or workplace well-being as part of their business strategy. Because we know that workplace well-being leads to an engaged employees, and engaged employees leads to better business outcomes. So how do they do that? So Doc Bang mentioned a very significant and important thing. It's under the branch of connectedness. So in Welby, we follow the principles of self-determination theory. That's the more popular, widely accepted framework for workplace well-being. And in that theory, it says that to have workplace well-being, there should be 3 things: choice, competence, and connectedness. So Doc Bang said like a few activities that can foster connectedness, because Filipinos are known for pakikipagkapwa. So that's very important to us. That's inherent to us. And then second would be competence. So how do they do that? So the companies should make sure that they encourage growth and development of their employees, promotions, career advancements like coaching programs and many seminars, many other things. And then good feedback system. They should know when they're doing good job, and they should also know when to improve. And then third would be choice. So we have to respect that everyone has autonomy. And to hinder that sense of autonomy in your employee, basi buwas wala na siya. Masaylo na siya, no? Especially now in this generation, Gen Zs and Millennials, we value very much autonomy, like our personal space, personal time, our personal contribution. So these are 3 things that companies should focus on by building that sense of system in place already as part of their business strategy.
So, Doc Mitz, as you have mentioned also, there's the factor of individual self. So, one person should be able to put in a boundary between personal space and workspace, etc. But right now, I think because of the work from home setup, that kind of space or that kind of barrier was actually blurred out. So, what advice could you give to people who are still on the work from home setup and dambagan nila mas busy pa niyang work from home compared sa personal?
Yeah. It's quite understandable because you are always plugged in, and so your employer or boss always has a way to get to you. But I think the solution here is that there should be like a memorandum or a policy in place that prohibits the boss or the supervisor from doing such. When it's not work time anymore, the work ends, and then it resumes tomorrow. So
I think that one is that's already adopted in Europe, I believe, because it's illegal, I think, in Spain for you to contact your employee after office hours. You're not supposed. Employees get penalized for it. So I think it's a good practice for us. We can start with that in I wish in respecting personal boundaries in terms of work and personal space. So I think that's it for this one. Any last few words, Doc Bang?
We always advocate that there is no health without mental health. So, amo ng motto sang DOH. And we have a lot of hotlines to look into. May mga Facebook pages like DOH, WVMC, WVH, WVS UMC. We have hotlines where people can call or can message in case they are in the edge of uncertainty or something like that. So do not hesitate to call our hotline.
It's a matter of connecting.
Yeah.
Sometimes it's a matter of people listening to what you have to say. Yes, Doc Mitz.
So Doc Bang covered already the advocacy on mental health. I'd like to focus more on workplace well-being because this is an aspect of mental health or well-being that's not very much embedded in our norms. So I would encourage everyone, if you're an employer or a business owner, a business leader, let's think about it. Make mental health or workplace well-being part of your business strategy. Ensure that a culture of well-being is set in place in your organization because the return of investment is actually there. So that's it. That's my spiel.
Thank you, Doc Mitz. How can people or how can employees and businesses reach out to you if they wanted to avail of your services under Welby?
So we have a website called welbyatwork.com. You can connect with that. You can also visit our Facebook page called at Welby.
Thank you very much, Doc Mitz and Doc Bang.
Thank you, Anvi.
Thank you very much. Thank you for watching today's Fyrside Chats. And we are here once again in Kuchu Cafe, located at San Rafael, Mandurriao, Iloilo. Today's edition was brought to you by Molavi Studios, Shaping Ideas. We also have Next Chapter, Capturing Stories, and Dame Digital, Marketing What Matters. Engage with us in the future editions and follow our social media pages, FyrLab Accelerator on Facebook and LinkedIn to check the next schedules. And we'll see you on the next Fyrside Chats.